Have you ever thought, oh, I wish I could be more positive? Or you ever thought, do you really believe the mind affects the body? Or, gee, I wish I could just be as up and outgoing as some of the friends that I have. Well, if you've ever thought those thoughts, you're in the right place. Join us. We are going to consider some profound ideas that not only can impact your health, but your life. Join us right now for Health is More Than Health Care.
Welcome to Health is More Than Healthcare with Greg Anderson. Join us for a fascinating exploration of the complete definition of health and well-being. It's all about our role as active participants in our health and what we can do to get well and stay well. Now, meet our guide and coach, Greg Anderson, 24-year survivor of stage 4 lung cancer, best-selling author of 11 books, and founder of the Cancer Recovery Foundation group of charities. He's an international award-winning authority on wellness who practices what he preaches. Please welcome Greg Anderson.
All right. Thank you. Thank you so much. It's an honor that you're here today, and I'm honored to be with you here today. I'm also honored that the audience, the studio audience, is inviting all of our viewers to kind of join in with us, because this is a very important subject that we're talking about health and trying to expand the definition of it being much, much more than health care. Today we're covering this segment we're covering the subject of attitudinal wellness. And this leads us to the mind and the body connection. And is that a real phenomena? That's what we're going to discuss. So get ready for an action-packed half hour here. I think we're all together in a quest that we not only want healthier lives, we want better lives. And that's what this segment is really all about. Well, I think I need to take just a moment to tell a little bit about my background. I came to this subject out of pure fear, personal need. In 1984, I was diagnosed with lung cancer, stage 4. And I actually had a surgeon tell me he thought I had 30 days to live. And so when I say to you today, it's an honor to be here, I really mean it's an honor to be here. I mean that very seriously. And what I did is not necessarily the only way to health and healing, but it is a way that we have demonstrated through literally interviews with 16,000 plus survivors. And what we started to do, we started to interview people, and then we sent out surveys, and over the years this number has grown and grown. And we've tracked certain patterns, and it's fascinating to see the patterns that have developed. We started out, today we have it what we call our wellness pyramid. And this pyramid is really it's kind of a shorthand in terms of what we can do to get well and stay well. All that we're talking about is in addition to medicine. It's not in place of it. And we're believers in the appropriate use of conventional medical care. There's no question about that. But where most people stop at that, we want to take people well beyond that. And that there's many more aspects than just visiting the doctor and maybe going to the hospital or for a procedure and that sort of thing. And it starts with nutrition, hugely important. And of course, it extends beyond that to our social well-being. That has to do with our relationships. Today we're talking about the mind and our attitudinal wellness. That's hugely important. But then also, as you'll note, you'll see vocational wellness, which it's not about a job, it's about a mission, a purpose. It's really about serving others. And then the whole issue of spiritual well-being. It all works together. It's all, there's tremendous strength in that unity. And when we bring all these resources to bear, things happen that cannot happen, positive things happen that cannot happen in normal hours. So we're big believers and want you to understand that health just extends well beyond the doctor's office. It expands well beyond the medical complexes around the world. I'd just say also, as a point of perspective, we've talked for years, we've talked about the different health, I call them health circles. And a lot of debate that takes place around the world is focused not on health, which is what you and I basically can do to help ourselves, but it's focused around health care, that is the providers, and health care financing. I don't care what the country is. I don't care if the payers are private or government or whatever. The same debate you see taking place all over is the health care payers telling the health care providers to lower their costs, and increase their quality. What's left out? Health. So often health is left out of that health care discussion. We're trying through this series to bring it back in. And I hope that makes sense to you, and we're excited that you would do it. You see this rope down here, again. Some of you who've been with us for several sessions know about this. This is the symbol of the seminar I attended that was done by a rope walker. Somebody that a seminar I didn't want to go to, but it's the most memorable seminar of my life. He talked about focus. And he said, focus on just the next piece of the wire, they call it, right in front of you. He said, all your focus needs to be there. He went on to share about his family. They actually had years of doing this sort of thing. They would string wires between skyscrapers and walk out there. They actually lost an uncle to do it in doing that. He said the problem is we lose focus and then we get into a bind. And when you're up on the wire, particularly between buildings, you hear the wind just blowing through your hair, he said. And you can feel the temperature change many times because of the wind currents. What's the worst thing you can do when you're up on that wire between a building? What do you think he said? Look at the ground. Look at the problem and you will develop a problem, he said. Now, what does that have to do with our efforts here? Everything. Listen to me. If you take nothing else away from this series, take this with you. I want you to focus not on treating the illness. I want you to put your efforts on creating wellness. Think of what I just said there. Yes, you have to go to a doctor and you have to treat the illness. Yes, you have to get your health guides in place and focus on trying to do something with the problem. But the main job, the main task, in the vast majority of cases, focus on creating wellness. The very things that we talk about in this pyramid. And so that's what we're trying to talk about here today. And I hope that you receive it. I always like to get started now. We're talking about attitudinal wellness. I always like to get started on the subject with a little humor. We were in England, and we were talking to a preschool teacher, kindergarten, 4, 5, 6-year-olds. And she said, well, you know what we've done, instead of show and tell time, we have happy thought time. Happy thought, that's kind of an attitudinal thing. And I said, well, tell me more. What's this about? And she said, well, it's pretty simple. Somebody will bring a doll to class, and when it's their day, and they'll say, oh, that's a happy thought, and talk a little bit about being happy. I thought this was wonderful. This is the sort of psychology we all need. And maybe somebody else would bring some crayons, and coloring book, and oh, that's a happy thought. But she said one day it really surprised us. A little boy came to class. It was his day. I asked him, what's your happy thought? To which he replied, pregnant. She was taken aback. She said, what did you say? Pregnant. How can that be? Little boy said, well, yes, this morning, Dad and I were downstairs at the table eating breakfast. My mother came down the stairs and said, honey, I think I'm pregnant. To which my father said, now there's a happy thought. Attitude. Some quick thoughts. Attitude is an outward expression of an inward perception. May I repeat that? Attitude, your attitude, my attitude, is an outward expression of an inward perception. If I perceive something as troubling, negative, how am I going to respond to that situation? I'm going to be troubled. I'm going to be negative. We deal with people with cancer, a lot of people with cancer, in a lot of different countries. And the number one perception that we deal with is this widely held, it's a cultural belief that cancer equates with death. It's not true. The truth on that is cancer may or may not equate with death. In my own case, here I am, going on nearly a quarter century cancer-free from a 30-day to live prognosis. You know, there are thousands, even millions of us who can make that same claim. And attitude, it plays a central role in getting well and staying well. People have said to me consistently, well, Greg, attitude isn't everything. No, it's not everything. But it will get you into the neighborhood. Do you understand what I'm saying there? Yeah. As a matter of fact, it may not be everything, but it's the main thing. So, one of the things we do with our patients, I don't know if we can get a camera on this, but we help people go from, at first the fear is so great, some can't even say cancer. And we try to help them move through this to acknowledging what the issue is and ending up saying, I don't have cancer. I have courage. And that is going to see me well no matter what the outcome is. That's an attitudinal shift. It's an inward perception that resulted in an outward expression. Do you see how that all works together? Yeah. Hugely important, not just in health, but throughout life. What do I have here? I have a glass. It has some water in it. Okay? Tell me about the level of this water in this glass. Some would say it's what? Half empty. Yeah, that glass is half empty. That's true, isn't it? Half empty. Others would say what? Hey, that thing's half full. Which one serves us best? I can tell you there is no question. It's just like the tightrope walker's attitude. If we focus on the problem, that is the half of the glass that's empty, what do we tend to generate? More emptiness, more problem. Yeah. But we've seen this time and time again. When we can get patients to focus on there are options. I can help myself get well and stay well. There's so much I can do. While you can see situations that look just desperate, you see those turn around all the time. And no longer is it some sort of aberration from the statistics that people get well from overwhelming odds, but in fact, it's absolutely true. Time and time again, that attitude, that whole perception, I can do something to help myself, makes a difference. Do you accept that? Do you believe that? Do you live that? Oh, I hope you do. It'll make such a huge difference in our lives. Well, I think beyond this idea of inward perception, I want to cover just very briefly some of the common obstacles to attitude. And let's just go down this list. I'd say one of the biggest ones would be discouragement. And we tend to deal with so many people, if they're doing some sort of treatment that isn't working out or just the diagnosis of a serious illness, that discouragement can lead to defeat, to giving up, that, well, there's really not much more I can do. See, that attitude it's central in the healthcare equation. And yet, time and time again, we overlook that. I'm asking us to put this right into the middle of the healthcare equation. Or change. Change is a big issue for many people. I've been with this doctor for years. I know things aren't working the way they should, but I trust him. I just don't want to change. Well, that's an attitude, I think, based a lot in fear of the unknown and what would it mean if I had to go to another town and that's... No, the successful patients are open to that change, and they'll follow up and do that. Another obstacle, I think, to attitude is the problems. Oh, this treatment is just too difficult. The whole thing is just too much. No thanks. I give up. No can do. Or we mentioned the fear that cancer means death. And that is true of all sorts of major illnesses, major problems, is that whatever it is, I may struggle, I may try, but eventually this is going to get me. That's focusing on the ground. That's focusing on the half of the glass that does not have water in it. And it absolutely paralyzes appropriate action. And then finally, I would just say that the whole failure issue, the cancers come back. The disease is haunting me again, time and time again. That is a point. Recurrence is a very, very fragile, critical point in a patient's life, and we have to treat that with just tremendous care and respect. And when that whole issue comes, that it's come back and there's nothing I can do, that's time more than ever when we need to work on attitudes in a real way. Well, we have with us today some just uniquely talented people that I want to introduce you to. And we're going to get some medical perspectives on attitude and some metaphysical perspectives on attitude. Dr. Jan Sidorov, internist, consultant on disease management, which I find fascinating. And, there are many questions we could ask, but one that I'd like to know is, the whole issue of mind. How big of a role do you perceive that might play, the whole attitudinal issue in managing disease?
One way us doctors think of it is flow, if you will, flow from the central nervous system, which has its wires, obviously, in every corner, nook, and cranny of our bodies, which sets both a push and pull phenomenon through the sympathetic and parasympathetic nervous system. Very, very complicated, but think of it as push and pull. If your central nervous system is driving you in a push kind of way, there isn't a cell, a molecule, an organ in your body that isn't being affected by that in one way or another. And if you're battling a condition, a chronic condition, even cancer, that influence of the central nervous system can make a big difference in how that condition progresses. If you have migraines, your migraines will get worse. And there's pretty good data to show that if you've got cancer, that kind of attitude from flow from the central nervous system can make a big difference in your survivorship.
Yeah. I just want to say, I am pleased. Aren't you pleased to hear a doctor, who is so liberated on this? I mean, we salute you, Dr. Sidorov. There are still many who are not as, if I may say, liberated as Dr. Sidorov is. I just want to address this whole attitudinal issue from another perspective. What's the answer if we have a negative attitude? Part of what we're dealing with is just these random thoughts of doom that can overcome us. I love the word, awfulizing. Isn't that a wonderful word? Awful. We just take things to their worst possible condition, all these terrible thoughts. And we have with us today a woman that I want to invite up here to do a little instruction. Would you please welcome Gigi Jantos? Hi, Gigi.
Hi, Greg.
Gigi is a Reiki instructor, a stress management teacher. Gigi, would you kind of give us a demonstration of how one might go about kind of watching their thinking, to think about what's flowing through our mind? Please.
I'd like to talk about mindfulness, which by definition is paying attention on purpose to the thoughts and actions of your life. You might be surprised to know that we have about 60,000 thoughts a day. And so it's hard for us to keep that mindful perspective because so many things are racing through our minds. And interestingly, studies show that about 70% of those thoughts tend to be negative. Well, after a while, this gets us caught up in a cycle of stress, which definitely can affect our health. Words like aware and notice are good words to describe the mindful experience. For instance, you might ask yourself, am I aware of my thoughts right now? Or you could ask yourself, am I aware of the quality of my thoughts right now? And if you are sitting there making your grocery list, you aren't aware of the quality of your thoughts right now. You're not in the present. Our breath is a great tool to keep us present and in the now. So I'd like to invite you to do an exercise with me, those of you here in the audience and those of you listening at home. Turn inward for a moment to your breath and notice it. And what you'll notice right away is that your body moves as you breathe. And each of us has a signature or a rhythm that goes along with our breath. And if we turn inward and notice that rhythm and become aware of that rhythm, it brings us into now. And we can feel that sense of our thoughts that might linger in the past for what should have or could have, or our thoughts that go into the future of worry and concern. We just have now with our breath. And many times, after we check in mindfully, we feel calmer and more focused. And I hope that's what you've experienced today.
Isn't that marvelous? That's a simple exercise that we can all do. Thank you, Gigi.
You're welcome, Greg. Thank you.
Oh, mindfulness. That's the answer to awfulizing, isn't it? Now, I would guess that a lot of this generates questions, and I don't know if there's anybody here who might have a question regarding this subject. Does anybody here have a question? I see somebody signaling over here. What is your name?
Viola Short Davison.
Hi, Viola. What is your question?
Well, I'm wondering if you really feel that our mind affects our physical bodies. That seems like a stretch.
Yeah, that's a good question. That's a question that's asked by a lot of people. Let me try to answer that the best way I know how. There's a fair amount of research, a lot of research, that will demonstrate that a thought actually changes biochemistry. And doing a technique similar to what Gigi just taught us, you can actually reduce levels of its cortisone sort of derivatives in your body. You can reduce those. Those are an immune suppressor through nothing more than a thought. And I'm sure many of you have done the test of the lemon. You know that one where you take an imaginary lemon? Just do that with me real quickly right now. Just imagine you're in your kitchen and you take an imaginary lemon. Boy, that thing is yellow, tart, juicy. Now take that and just in your imagination, put it in your mouth and bite down. Let it swirl around a little. Just imagine it. Can you taste the tartness? Did anybody have any physical response to that? Several people did, because what happens is just by a thought, you generated a response of saliva. Nobody had a lemon. That's the power. That's just a small demonstration of the mind's ability to to change the body. Well, you know, when we talk attitude, I'd like to leave you with a thought. I want you to complete this on your own. It's a wonderful thing because in addition to not awfulizing it, focuses on being grateful. Think of this sentence and complete it in your own mind. I am so happy and grateful now that, and you fill in the blank. And I want you to hold that thought. I am so happy and grateful now that, and then complete that. Are you with me? And hold that thought. For those of you watching at home, I want you to do the same thing. And I want you to look at the information at the bottom of the screen, the toll-free number, the website. Contact us. There's a myriad of resources here. We're here for you, and we think that you, by participating, will change your health and your life, because health certainly is more than health care. Thank you, everybody. Great to be with you.